Welcome to the regular meeting of the Public Health, Safety, and Equity Committee for August 19, 2026. I am Jason Chavez, the chair of this committee. Before we begin the meeting, I want to offer a friendly reminder to all members, staff, and the public that these meetings are broadcast live to enable greater public participation. These broadcasts include real-time captioning as a further method to increase the accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments for the broadcast. We ask all speakers to moderate the speed and clarity of their comments. At this time, I'll ask the clerk to call the roll so we can verify a quorum for this meeting.
Councilmember Payne is absent. Wansley is absent. Rainville?
Present.
Vita?
Present.
Whiting?
Present.
Vice Chair Stevenson?
Present.
Payne?
Present.
And Chair Chavez.
Present.
That is 6 members present.
Let the record reflect that we have a quorum. I'll remind my colleagues that we'll be using speaker management today, so please make sure you're signed in. Today, we'll begin with our consent agenda. Our consent agenda is as follows. Items 3 organizes a contract amendment with Professional Recovery Organization Network for firefighter mental health services. Item 4 authorizes a contract amendment with Axon Enterprise, Inc. for additional software licenses, body-worn cameras, digital video storage, tasers, and related equipment for the police department. Item 5 authorizes the submittal of a grant application to the U.S. Department of Housing and Urban Development for a Healthy Homes Production Grant. Item 6 amends Council Action 2023-A-0535 related to a grant from Hennepin County Human Services and Public Health Department by correcting the amount to reflect a total of $2.56 million and include Wellstone High School to provide the health mentor model. Item 7 refers to staff the subject matter of a commercial hood and exhaust cleaning program ordinance. Item 8 sets a public hearing for September 9, 2026 to consider an ordinance related to neighborhood revitalization program policy board elections. Colleagues, is there any discussion or are there any items that anybody would like to pull for further discussion? Vice Chair Stevenson.
I'd like to pull number 4 for separate discussion.
Separate vote on that as well?
Probably not, just discussion.
Okay. I think we can, if it's just discussion, we can just have a conversation about it. Vice Chair Stevenson. You may go ahead. Yeah.
Oh, sorry. Yeah, I was just curious. I'm curious about the numbers here. In the amount of 1.4 million for a total not to exceed of 18 million, that's a really big gap. I was wanting to understand these numbers and what, how much we're anticipating to spend. Are we buying the equipment or are we leasing the equipment?
If folks from MPD, welcome.
Chair and council member, what we're doing right now is we're not upgrading any equipment. We're not expanding any service. We're just getting additional body cameras and tasers and the supporting equipment for that. This is a singular purchase to support that through the life of the contract. The 18 million, that's the overall cap of the contract. So in theory, 2 years from now, you could approve that MPD will have 1,000 officers, and then I would come back requesting additional body cameras. And as long as we stay underneath that cap, it's an approval for council. Does that make sense?
Yeah, that makes sense. So are we purchasing the equipment or are we leasing the equipment from them?
It's in a purchase with a refurbishment in the future, like we have with our existing body cameras right now. So as the new technology comes out to upgrade the body cameras, that's on that replacement plan.
Okay. Okay. All right. Thank you. That's what I wanted to know.
Vice Chair Stevenson, did you just have questions or did you want a separate vote on that?
Questions was it.
Okay. All right, colleagues, since nobody else is on queue, I'll move approval of the consent agenda, including referring number 7 to staff and setting a public hearing for number 8. All those in favor say aye. Aye. Those opposed say nay. Any abstention? And those items carry. Colleagues, next we have our public hearings. Anyone who signed up to speak will be given 2 minutes each to testify. For everyone in attendance, and especially those who may participate in our hearings or comment period, let me offer this notice. These hearings are being recorded and broadcast. Both the recording and broadcast are classified as public data under the Minnesota Government Data Practices Act. By attending and participating in these proceedings, your image and any testimony or information that you provide will also be subject to disclosure under that law. That includes but is not limited to your attendance, your name, or other personal details you provide, as well as any testimony or comments you provide, in which includes any written submissions you make, which are included in the record of this meeting. Our first public hearing is regarding the Noise Regulations Ordinance. I will take note that these are 5 ordinances together. I'll invite Environmental Programs Director Kelly Mulman to present. And I didn't miss attendance of anybody, correct? Okay, great. Welcome.
Good afternoon, Chair and Council members. My name is Kelly Mulman. I'm the Director of Environmental Programs for the Minneapolis Health Department. I'm here today to speak to Chapter 389, the city's noise ordinance, bringing forward an amendment, and then, as mentioned, 4 other ordinance amendments as related. The city's noise ordinance spells out the city's authority for regulating undesirable noises that can create a threat to the health and welfare of the people of Minneapolis. Chapter 389 covers noise limits set by the state and the city to be protective of health and welfare. It includes penalties for violating noise limits. It lists activities exempt from noise limits. It speaks to amplified sound permits, vehicular noise, and noisy and unruly assemblies. The changes that I'm bringing forward today is a complete revision to accomplish the following objectives: to reorganize sections to improve the logical flow of the ordinance, to simplify language, improve consistent use of terms, and cut out unnecessary content, and to move noisy and unruly assemblies to its own article within the chapter. Additionally, we're adding language under alarms, regulating the sounding of motion sensors on private property so that the audio is not audible from adjacent residential uses. That language is here in front of you. So the new language is highlighted under number 4. Says the sounding of a motion sensor on private property so far as is not audible from an urban neighborhood or residential mixed-use district boundary or a permitted or conditional residential use. This issue came about because we've received a number of service requests over the last year complaining of a neighbor having a Ring camera that had an audio recording that was triggered as part of a motion sensor, and that going off regularly throughout the day and disrupting the peace and welfare of the adjacent neighbor. So those are the changes that I wanted to bring forward to you today, and I'm happy to stand for any questions.
Thank you. I think it would be good if we first set up the public hearing, then we open up for comments, council comments or questions. Okay, perfect. Great. So with that said, I'm now going to open the public hearing, and the first person to sign up is, it says the first name starts with the H, and I think it's Damer last name. Okay, hi. Welcome.
Good afternoon, Chair and Council members. My name is Roy Dahmer. I'm a resident here of Minneapolis, and Fifth Ward specifically. And I'm here today in regarding item 1, which is a proposed amendment change to Chapter 389 noise regulations. I wanted to highlight Section 3 of the staff report, which explicitly acknowledges there was 0 targeted communication or engagement with Minneapolis residents or property owners prior to the draft of these changes. The report notes that this is rewritten and driven internally by the inspector. While administrative cleanup makes sense, codifying restrictions and standards for residential security devices without public input creates an arbitrary policy which responds to an isolated neighbor dispute rather than addressing actual systemic noise issues across the city. Specifically, the language that penalizes motion sensor chimes and audibility past property lines creates, in my opinion, an unreasonable and unenforceable standard. Ring cameras are used across the city by thousands of people for basic deterrence of perimeter awareness and property safety. Factors like lot sizing and proximity make zero off-property audibility virtually impossible standard for security devices or that specific feature within the security device. By writing this clause in the code, city risks by creating an administrative mechanism that can easily be weaponized by neighbors or personal grievances against responsible homeowners that are simply trying to keep their property secure. I ask that the committee remove or strike the specific motion for this clause today. Thank you.
Thank you. Is there anyone else that would like to address the committee? Going once, going twice, going 3 times. Seeing no one else wishing to speak, I will now close this hearing. And colleagues, I will now open it up for you to ask any questions or make any comments. Councilmember Rainville.
Thank you, Chair. Director, I just do have a question. I got an email from a resident who probably is the source of these complaints you've been getting, and explained that she's only 5 feet away, 10 feet away from the property next door to her. So when her Ring camera speaks, it's very close by and can be heard from the property next door. Is that, I mean, it just seems like an issue that can be looked at a little closer. Is that okay to really delve into that? Or is it just a blanket problem, the amount of noise?
Chair, Councilmember Rainville, could you clarify what you mean by look into closer? And
I'm sorry, I'm not being clear on this. So her camera is 10 feet away from the neighbor's property line. So when it goes off, when it speaks, when it's audible, it's very, very close by. So thus, do they have, and I'm not familiar with Ring cameras, do they have a volume and it can be turned on? Is that what you want to achieve in the ordinance?
Yes, Chair Chavez, Councilmember Rainville. The Ring camera motion sensor has a sensitivity setting for the distance, so where it gets triggered. So we have had some issues where somebody just walking by or a car driving down the street has set it off, which seems unreasonable. And then it also has a volume control. So the volume can be turned down so that you have to be much closer to the property to hear that the sounding of that recording.
Okay, great. Thank you for letting me know that, and I'll pass that information on. Thank you.
Councilmember Rainville, is that the only questions you have?
I'm sorry.
I just want to make sure that you're on cue for, I think the system is broken, so. Great, okay. Councilmember Whiting.
Thank you, Chair Chavez, and thank you, Director. Just kind of wondering about the specific scenario here. Can you kind of explain to us a little bit? It sounds like it's coming from, this ordinance change is coming from, is it one incident or there's been multiple incidents? Can you kind of give us a little bit of background on that?
Yes, absolutely, Chair and Councilmember Whiting. There have been multiple complaints that we've received at various addresses across Minneapolis, so this isn't an isolated incident. We're seeing the issue arise more and more often. We actually had one referred to us from, I believe, your office earlier this week, where there was a multi-unit property and someone was walking by on the sidewalk and it went off. So we're seeing a lot of service requests or complaints come in through 311 to our inspectors. One of the reasons for bringing this forward is because the sound is triggered by motion, it's intermittent. We can't take our standard sound sound level measurements because it's not going constantly. We take those for 10 minutes and then take the average. So with something like this, we have to be able to say, is it audible or not audible at a certain distance from the source? And that's where the recommendation comes from here.
Okay. Do you have kind of an estimate of how many complaints that you've all received in the last year, 6 months, et cetera?
I'm going to look to my inspections team. Okay, with 10 and north, 1, 3, 2, just in the last probably 6 months.
Okay, that's helpful. Thank you.
Right, Conley's. I'll move this for approval. And seeing no one else on queue, I'll ask the clerk, I'll move this.
Second.
Sorry, seconds. Those in favor say aye. Aye. Those opposed say nay. Any abstentions? All right, that motion carries. Thank you. Our next public hearing is regarding pet ownership restrictions ordinance. I will now invite Animal Care and Control Director Schindel for that presentation.
All right. Good afternoon, Chair Chavez, committee members. My name is Tony Schindel, Director of Minneapolis Animal Care and Control. I am here today to present on a topic that was initially authored by Councilmember Wansley and also co-authored by a couple other council members. And this particular ordinance amendment that was brought forward is recommended to amend Minneapolis City Ordinance 66.80 specifically for our justice impacted residents who are convicted of a violent felony. And under that definition, it's specifically listed in state statute. It's a very broad definition of felonies that qualify. And it is anything from, just to name a few, any drug charge, any murder or assault, burglary, domestic assault, things of that nature. And it simply is just striking that language and actually adding a couple other helpful statutes to help us in actually keeping pets from people who shouldn't be owning them, when in fact this ordinance, we feel, actually prohibits our justice impacted residents from owning a pet who really are, we found, good animal owners. And I'll share some data at the end that might be helpful in making a decision on this today. Also, I wanted to give a special thanks to our author and co-authors for the special unique title that was given to this. I certainly can't take credit, but all right. So as I mentioned, really it's 66.80, which talks about pet restrictions for felons particularly, who happen to be our justice impacted residents. It requires currently somebody to have a prohibited animal permit for somebody who has been convicted under one of those qualifying state statute offenses that I noted, and any animal that weighs 20 pounds or more. So specifically we find this just more for dogs, not cats. Some of our key changes for this proposal would be striking the language that makes this ordinance apply to anyone convicted of that qualifying felony under state statute, and rather than just an animal cruelty conviction. Also enumerates the reasons why that an animal could pose a danger to the public even with this change. We'll continue at Animal Care and Control to maintain the authority to regulate ownership when someone previously owned a dog declared dangerous and or potentially dangerous. And we'll also add language that would explicitly provide MAC the authority to deny permit applications for those with an animal cruelty conviction, which really is the most important here, and anybody that has been convicted under Minnesota Statute 343.21, which is the Animal Cruelty Code, and then also Minnesota Statute 609.205, Clause 4. And that specifically talks mostly about owners who are negligible in their ownership of animals and use them to cause harm to the community. And some of the main reasons driving this proposal is we find the current language is unnecessarily restrictive. It incorrectly assumes that someone with a qualifying felony under that state statute wouldn't be a good pet owner. In fact, in my tenure with the division, we found that these felons often are great owners and they've just had an unfortunate situation in the past and they want to have a good ownership and a relationship with their pet, and they're prohibited by doing so because they're often met with an immediate $250 application fee, which this would also remove. So just to have a pet over 20 pounds, they would have to pay $250 to our office to have even myself or someone from our staff review that application. So this will also help them because they're often at times looking to, help get their life back on track and find housing and things of that nature. And we rarely do find cause to deny an application. And again, this fee really acts as more of a burden than effective tool to increase the public safety. By doing this and removing hidden fees and barriers to our justice impacted residents, it'll also help them find housing. Like I mentioned, it'll align with the City Code 2025 Civil Rights Ordinance that upheld equal rights and protections for all renters. And it will also be an effective tool through city ordinance to deny an application based on animal cruelty. And that's really our goal here, and or when the animal poses a risk to the public safety. And the implementation piece of this would be rather quick and easy. It could be effective immediately upon publication to eliminate the permit requirement, and that would immediately remove the $250 application fee for our justice impacted residents. And it would include relatively simple operational changes on our end. So I know we went back and we pulled some data from 2020, January 1st of 2020. So looking back since then, we've only had 18 of these permits or applications come before us. Of those, 11 were approved and 7 were denied. And most of the denials were based on the aggression piece, where the animal we wouldn't want in the community anyhow. And I'd also like to note that standalone, that felony conviction wasn't enough for us to deny ownership. We also had to essentially prove that the animal posed a risk to the public safety. And in any case, the animal owner had a right to a hearing, an administrative hearing, and then they would present their case before the city and a hearing officer, and they would ultimately make the determination if they could own an animal. And also, I just want to conclude this presentation by just noting that certainly our goal here is not to, put the public at risk. I, in fact, think this will do just what we intend it to do and continue to keep the public safe, but also help out our justice impacted residents who really are good pet owners, and really restrict ownership and prohibit ownership from folks who are using an animal inappropriately, such as harming them, causing harm to them, and or allowing them to pose a risk to the public safety, which all of those same things in the added amendments will help us do that even better. So, but with that concludes my presentation, and I'll stand for any questions.
Thank you for the presentation. We'll first proceed with the public hearing, and then we'll go to questions and comments. At this time, I'm going to proceed to open the public hearing. The first person to sign up is number 1, Daniel. Welcome.
Good afternoon, Chair and Council members. My name is Daniel. I want to focus on one specific change in this ordinance. Right now, Minneapolis requires certain people with violent felony or convictions to get a special permit if they want to keep an animal over 20 pounds or another animal care and control believes could be dangerous if misused. That is not a ban. It is a temporary permit and review process. This ordinance eliminates that requirement. It keeps the existing rules that apply after dangerous animal incidents, and it adds new restrictions for animal mistreatment and for second-degree manslaughter involving an animal. MACC has said these permits are rarely denied, and that the process is therefore more burdensome than useful. I take that concern seriously, but a low denial rate by itself does not show that a preventive safeguard serves no purpose. So I think the real question is about prevention. The current law accepts the risk that some people who would never misuse an animal still have to get a permit. The proposed law accepts the opposite risk, that someone with a recent history of serious violence may keep a large or potentially dangerous animal without review until there is an animal-related reason for the city to act. I think the first risk is more reasonable. If the current law is too broad, narrow it. If the fee is too high, lower it. But please do not eliminate the preventive safeguard entirely. Thank you.
Next up, we have Mike.
Chairman Chavez, members of the committee. My name is Mike McCaney. I'm a Ward 2 resident, and I directly experienced this process. And when I experienced it, I thought this is a lot of work to have a dog. The pet ownership ordinance in front of you, 2026-00871, is something that I wrote Councilmember Wansley about, and probably why we're here today. First off, I want to be clear up front. I'm not here to play the victim. I have a felony conviction. I own that. And I've worked to build a different life. But a fee on my dog doesn't answer for my past. It just punishes me for still being here and trying to live the best life possible. I'm in recovery, and having a dog to come home to has been one of the most important parts of the recovery process for me. Having that unconditional love is amazing. Little history: in February, I adopted a dog, named him Houdini. I got him from the city's own shelter. He's a 73-pound American Bulldog. He's afraid of the vacuum and sleeps with his back and legs in the air and likes belly rubs. He's neutered, he's microchipped, he's vaccinated. I did everything right. He has better health insurance than I do. And the city adopted him to me. And then the same day, turned around and said, hey, you got to pay $250 extra to get a license. Then you got to pay the $30 everybody else has to pay. And my understanding is I have to renew this permit every year. And I'm assuming the $250 gets charged every year. Correct me if I'm wrong. So I'm assuming every year my dog's alive, I'm going to have to live with this. Nobody came to inspect the house. They just approved it. And I've worked really hard to redeem myself. I raised dogs for the blind while I was incarcerated. And basically, this is a tax. Thank you.
Thank you. Is there anyone else that would like to address the committee? Going once. Welcome. And once you're done speaking, if you mind just signing in so we have your information.
Where do I sign in at?
After you
Okay,
speak. Yeah.
I'll do that.
Welcome.
Hello. Good afternoon. My name is Jonte Hudson, and I am a Northeast resident of Minneapolis, but I also work for Small Sums. And Small Sums did issue a letter on behalf of their organization for this ordinance, but I want to talk a little personal. I'm 1 year out of incarceration for 21 years at the age of 16, and what an animal means to me with no kids is family. Most people treat their pets like family, but this ordinance put in place that you got to pay to have family. And I believe that that if this ordinance is changed, that it will help a lot of people getting out of incarceration not to have to worry about just one more fee, one more thing they have to pay for: clothing, shoes, housing, transportation, yet you got to have a pet. I don't know exactly how much this ordinance affects the emotional support dog, but that is also something that individuals should look into. A lot of people getting out of incarceration use their pets as family, emotional support dogs and things of that nature. So to have to pay something that another group of individuals does not have to pay is strictly wrong, in my opinion. If I did my time, I should be treated as such a part of my community. I do a lot of outreach organization work. I'm a part of the community, but yet when it comes to my dog, I'm not. I believe that's just not fair. Thank you.
Thank you. Is there anybody else that wishes to testify? Going once, going twice, going 3 times. Seeing no one else wishing to speak, I will now close this public hearing and open up this ordinance for discussion. I'll first pass it to Vice Chair Stevenson.
Thank you, Chair. This is a beautiful ordinance that we're looking at. A lot of people, as the last person said, get a lot of love and support from their dogs, from their, well, this probably won't affect cats, but from their dogs. And having an exorbitant fee on this just means that the poor can't have it, but the rich can have it. And I don't think that's right. And then just from my personal experience, I used to work in homeless outreach, and a client of mine, he was a native elder. He was just as impacted. He unexpectedly lost his housing, and so he was outside. And as a senior citizen sleeping in a tent in Minneapolis outside, he was extremely depressed. And really the only thing, and I mean this exactly, the only thing that kept him from killing himself was his dog. And, you know, if he probably was able to pay for this fee previously, but in this year-ish time when he was outside, he would not have been able to pay this fee. And so to have taken his dog away from him at this time would have been disastrous. So, yeah, for him and for many others, I think we should move forward with this. This is a great thing to do for our community. And I think we should call the roll on this item.
Thank you. Next up on queue, just want to thank Animal Care and Control, Reg Services for all the work on this policy. It is literally going to make a difference, and it's very important. I also want to thank Councilor Wansley, Councilor Chaudhry, and Councilor Whiting in my office as well. And thank you for the communication that was sent at the beginning of the year. I remember reading that email, and it was very heartbreaking, but I do know that staff from Animal Care and Control was immediately like, here's what we can do about it, and now it's being brought forward. So it's incredible just to see it happen, and because of your advocacy, so many other people's lives are going to be improved as well, because this has happened to other people. So just thank you for that. Last year, the City Council also passed the comprehensive civil rights ordinance, adding justice impacted into our civil rights protected classes. And I see this as another step forward in that direction, and really excited to vote for this. So I just want to add more information and thank staff for the presentation as well and the work behind this. Next up, we have Councilmember Whiting.
Thank you, Councilmember Chavez. And Director, I have a few questions for you related to, and one, obviously I'm co-author, so in support of the ordinance, but I've had a few residents kind of reach out with, I think, confusion. I think the title of the amendment itself, I think, is not as clear about what this ordinance is actually changing. Can you kind of speak to, it is my understanding that this ordinance does not allow individuals to have future ownership of dangerous or potentially dangerous animals. And this isn't changing that. Like, those restrictions still exist for anyone as they would for anyone in the city of Minneapolis. Can you kind of talk about that process broadly?
Yeah. Through the chair, Councilmember Whiting, thanks. Great question. So that is correct. The title is kind of a little bit misleading and maybe not fully encompassing of what the actual amendment is here, but potentially dangerous, and order for destruction are the three different levels in which our office can declare an animal. This mostly applies for dogs, but certainly can for cats as well. But our office reviews anytime there's an animal bite or an incident or an attempt for an animal to attack a person when it's reported either through 311 or 911. And those cases are all reviewed by primarily myself, and I take everything into account. Our animal control officers meet with the victim of the incident or the animal bite. We meet with the owners, any witnesses that were involved. I review all that information. We look at other factors. Has this animal had any prior bite history? Has this owner had any prior other history with our office as well, and or in associated jurisdiction? And those are all factors we use to take into consideration. And we are taking a very progressive approach because we understand accidents happen, and no matter what, we want people to be able to own pets, right? And we need to, however, put restrictions in place for when they misbehave and when they are posing a risk to the public safety, and that's where the declaration process comes in. So potentially dangerous is the least severe. Some of those requirements, just to name a few, are a muzzle and a 3-foot leash they have to wear and be walked by an adult only. They have to register annually with us, and our office goes out, our staff, and checks on those owners and pets every 6 months is required. Dangerous is the next level of declaration. Those are all the same requirements, the sterilization, which is also for potential, the muzzle, the 3-foot leash, but it's also governed by state statute, so it follows the animal anywhere in the state of Minnesota. They also have to have signage, yellow signs that the state produces to be displayed in the front and rear of their property, just notifying folks that a dangerous animal does live there. And they also are required to have a $300,000 insurance policy to prevent against any potential injuries that may reoccur given the nature of the seriousness of the declaration. And then destruct is our reserve for the most severe crimes, maybe where an animal's already dangerous and it gets out and does some significant damage, then we would elect to do that. And again, the ordinance is not changing any of those restrictions. It's actually just adding, removing the piece about felony specific cases, and also just adding in some extra protections that we can do to help our four-legged friends be safe from people who have had prior animal cruelty convictions.
Thank you, Director. And I think it's really helpful, the clarification there specifically about, this is not removing any level of the process that you just laid out. It just, I think, ameliorates this for everyone. And in particular, and I think the piece that we are, I think, is quite helpful, that is overburdensome in this ordinance, is the kind of 20-pound piece. And so maybe, again, if I am incorrect here in my own assumption of what that means, is any person with a violent felony conviction as laid out by the statute has to go through this process currently if they want an animal of any sort, even if it's the nicest animal in the world, over 20 pounds. Is that correct, or is it like a dangerous, one of the three that you laid out, plus 20 pounds?
It is currently any justice impacted resident that has a felony under one of those qualifying convictions, they have to pose a one-time $250 application fee, regardless of the potentially dangerous or dangerous designation.
Right. So long as it is over, or with the 20-pound moniker.
That's correct.
Okay, perfect. Thank you.
Thank you.
That is all. Thank you so much.
Councilmember Vita.
Thank you, Chair Chavez. Thank you to the community members who got this going. This is really cool. As a dog owner and a dog lover, I actually believe you should at least have 2 dogs. One is so lonely, not only for you, for them. They need friends just like we do. And I often say, the human owners put so much stress on one pet because we have so much to give them when we come home, or when we're going through tough times and happy times, that you should at least have 2. And so I'm grateful to anyone who wants one. Pets are a lot of work, especially dogs, especially fosters. I ran into Tony a while ago and I asked about something similar, and he told me that some of my colleagues were working on this already. So I'm so proud of the work that's being done around here. Nothing we've done in our life should stop us from loving pets, and I think one of you said that. I certainly am aware that people harm animals, and there are protections that are in place and should remain in place so that never happens. So I appreciate those guardrails still remaining there to make sure that our furry pets and family members are protected. But I'm proud of the work that this community is doing around this. I think folks who are justice impacted should speak up for themselves and say, I want a pet just like everyone else does, and I don't want to have to pay extra. Because $250 is a lot. When you're a pet owner, there's lots of expenses that come with it that you don't know. That's a medical bill, that's dog food, that's a pet sitter, that's out at a dog park or something, wearing them out. When you have to go to work, you want them to be tired sometimes when you get home. And so $250 is a lot of money that I would love to be seen I would love to see be used towards something else for your pet, you know, a toy or something other than fees that no one else has to pay. And you certainly should not be penalized for having furry family members. So thank you all so much for this. Definitely support this. And I'm proud of my colleagues who brought this forward and who's doing this work to make sure folks get to have furry loved ones in their care as well. And like I said, have two. Why not? Thank you.
Love it. All right, colleagues, no one else is on queue, so the clerk may call the roll.
Councilmember Payne.
Aye.
Rainville.
Aye.
Vita.
Aye.
Whiting.
Aye.
Vice Chair Stevenson.
Aye.
And Chair Chavez.
Aye.
That is 6 ayes.
And that motion carries. Thank you all for being here. We will now move on to the receive and file part of the agenda. Our last item, receiving a report regarding the opioid response and mobile medical units. I will invite Public Health Initiatives Director Luisa to begin that presentation. Welcome. Welcome.
Hi. The slides, oh, there they go. Okay. Good afternoon, Chair Chavez, council members. My name is Luisa Brandao. I'm the Director of Public Health Initiatives with the Health Department, and I'm happy to be here today to present on the city's opioid work over the last, since the beginning of the year. First, I'd like to acknowledge that this work is done by our incredible opioid response team and our MMU team. Neither the teams, the staff cannot be here today because they are out in the field doing the work. So, but I do like to introduce Suzanne Young, our opioid response work manager, and Dr. Nataba, who is our medical consultant, medical director for the MMU. Starting with some data, we have seen since our peak of opioid-involved overdoses in 2023, we have seen slight decreases in Minneapolis and also in the state. However, our rates are still very high, and it is not going to zero, which is what we would like to be able to say, right? Nobody should die of an opioid-involved overdose. And we have significant racial ethnic disparities. We see that the rates for our residents, our Black and American Indian residents, are 4 and close to 30 times higher than that, the resident rates for our white residents. And the disparities are much higher than what we see for Minnesota as a whole and the US as a whole. So work to do. Additionally, Minneapolis as a city is overrepresented in the state's opioid overdose deaths. We have about 7% of the state's population, and yet we represent about a quarter of those opioid-involved deaths. So definitely quite a bit of work for us to do as a city. So I am going to present on our opioid response initiatives. We have several, and that from harm reduction to youth prevention activities. Narcan saturation and syringe abatement are both harm reduction and prevented in public safety issues. We also have our MMU and First Step programs, which are both public safety, but as well as treatment, and then our Brainwaves program, which is a youth prevention initiative. In terms of Narcan saturation, we continue to expand access to naloxone as part of our overdose prevention efforts. We currently have 3 vending machines at fire stations, Fire Station 21, 14, and 5, and are in the process of working to install a 4th vending machine at Fire Station 12. Additionally, our ORT, our opioid response team, is working with community leaders in Cedar Riverside to explore what are the best strategies to increase access to naloxone in that area of the city. And we work with several community partners to distribute naloxone at pop-up events and community events to make sure that it's accessible, as well as through our MMU. And finally, the ORT team holds quarterly training sessions on naloxone use for community members. So those are open to city employees, outreach partners, community organizations, and the idea is to continue to increase community awareness of naloxone and increase individuals' confidence in using it if there is a need. In terms of our syringe abatement, we continue to focus on the issue of syringe and needle litter, and we use a four-pronged approach of sweeps, syringe drop boxes, responding to 311 requests, and training and education. So we have a contract with Mother's Love, and they respond to 311 requests and as well as do sweeps, and those are the numbers for January through July. We have currently 26 syringe drop boxes installed across the city and are working to add an additional 15 through a pilot project with the Minnesota Department of Health. In addition to that, our staff does periodic sweeps 2 to 3 times per week in high priority areas, such as the Southside Green Zone, Hiawatha Corridor, Penn Lowry, West Broadway, and other places. And over the past 6 months, the 311 responses and sweeps have, there have been over 1,000 needles collected, as well as in collaboration with a couple of businesses, we've gotten more than 700 discarded needles and syringes collected as well. So definitely trying to keep those out of the street. Then we have our mobile medical unit, and you can see the map is where the unit has been deployed over the past year. Actually, I think maybe today or tomorrow is a 1-year anniversary of the first time we went out. So currently, the unit today is on West Broadway with our Twin Cities Recovery Project partners, in Sanctuary. But the map shows where we normally are. We have been deployed the unit 168 times between August 22nd of last year and the end of July. In that time, we've interacted with over 4,000 Minneapolis residents and provided healthcare to over 900 individuals. 22% of all encounters have resulted in providing medical care. Of those individuals to whom we provided care, 32% were dealing with unstable housing, and we've also, through the MMU, distributed close to 1,500 doses of Narcan, or the intranasal naloxone. Additionally, our 900 medical encounters have resulted in over 600 referrals for housing, medication for opioid use disorder, treatment, in connection to community clinics for follow-up care. So in addition to doing that, there's been medication prescriptions and wound care kits have been provided to the individuals that have been there. And finally, we have been, to make use of the unit, because this is a great resource, our school-based clinic team has, on times when the opioid response group is not using it, taken the unit to do some summer school events, and we'll be using it for some back-to-school events. So the school-based clinic staff has someone that can drive it, and we'll be providing services out of it as well. And we'll continue to develop, we have developed new partnerships each time, and we've continued to develop partnerships with community organizations to find new places where there is a need for the unit and for us to be. We are always out in partnership with a community organization or a community group or a business or so that we are in partnership with someone that is trusted in that community. Next, I'd like to speak to our First Step treatment program. This is a program that is a low barrier program for access to medications for opioid use disorder. We started this program with Fairview Medical and in 2022 and have continued to work with both Fairview and are trying to expand. And it's being replicated across the metro and in other parts of the state. Since January, through First Step, both through the Fairview Emergency Department and our clinical partner, community partner, over 200 people have received medication just in the first 6 months of the year. And we are in the process of expanding, as I mentioned, so we are training community navigators, cohorts of community navigators connected to specific communities to be in the field and to connect individuals to treatment and to provide education on the low barrier and the medications for opioid use treatment. Additionally, we are working to build the capacity of our clinical partners. So we have a contract with California Bridge, and they delivered training to our community clinical partners on implementing this type of program in their clinical sites, and the pieces that need to be part of it. And so we're working currently with 3 additional clinical partners to expand access. And are working as well on making sure that we have the medication on our medical mobile unit. We are running into some barriers related to the legal pieces, but have a workaround for providing medication from our crosstown office where the unit is housed, with the goal of eventually having it on the unit so that it is an additional low barrier access point. And finally, youth prevention. Prevention is important. It's better if people don't start using substances in the first place. And so we have a curriculum that has been developed in partnership with the University of Minnesota and the Masonic Brain Institute. That's the right, yeah, Masonic Brain Institute, and it has been piloted. It was piloted at 3 of our school-based clinics with the health educators over the past year. We are in the process of revising and reviewing the curriculum and have submitted a grant to ORAC, the Opioid Epidemic Response, basically state funds. I can't remember what that stands for, but state funds to implement the curriculum at an additional at the 5 Minneapolis public schools with our school-based clinic staff and MPS staff. And that is all I have, and I'm happy to stand for questions.
Yeah, thank you for that presentation, Louisa, and the Health Department. I'll first pass it to Councilmember Vita.
Thank you, Chair Chavez. Thank you so much for this presentation. Again, just fantastic work that the Health Department is doing. I do have a couple questions because I think requests have gone up for cleanup around needle pickup around like Broadway and Penn and Lowry and Penn. So just wondering if you're looking at the future of a lot of requests that are starting to come in, and like what is going to happen with this program or funding to grow this, because it's certainly not getting smaller.
So we definitely have seen an increase in requests, and we have some of our own staff that is doing sweeps, as I mentioned. In terms of funding, and I will turn it over to Commissioner Ritchie, who can probably speak to that.
Thank you.
Thank you, Chair Chavez and Councilmember Vita. Yeah, we have a funding package that includes syringe mitigation. So we are continuing with the public health specialists that we have doing syringe mitigation and other harm reduction activities. And then also the contract with A Mother's Love will continue. And then with our project with the Department of Health, that expands our syringe boxes, and so our ability to be able to place syringe boxes and then empty those as well. So there's definitely funding set aside for the syringe mitigation program.
Got it. And then when you say like some of your team is doing these sweeps, like who on the team, who's?
So our public health specialist, Demir, and he's not here because he's out, but he and Tony Zaccardi, another public health specialist, go out and will do some of these sweeps, not necessarily in response to a request, but in areas that we know can be problematic.
Yeah, like
in
where
terms of
there's
syringe
a lot,
litter.
like the laundromat on Penn. Like there's a lot there, and you get a lot of requests for that. Okay, got it.
And just in terms of the requests that come through 311, those are sent to A Mother's Love and are addressed within 24 hours of the request being received by us.
Thank you. I think that's actually a wonderful program and a way to get that done because they have people they can deploy anywhere they need to go. So that's very helpful, and needles are very scary to families, especially with children. And so I really appreciate that program and hope that we can keep that strong. And if we need to figure out how to get more employees out there, I think we should figure that out too, because these requests are not slowing down. They're coming in more and more, I think, than they ever have before. The second thing I wanted to talk about is the mobile medical unit is so amazing. I love the work that you all did during Operation Metro Surge. It started out slow for me. I was feeling neglected on the north side with the mobile medical unit, but you all stepped it up big time, and I appreciate it. I greatly appreciate how you've shown up in North Minneapolis with the mobile medical unit, how you've been you've adjusted to where the things are happening at. That means a great deal to us. I love that people know where it's gonna be and know how to access it and that they feel safe. One of the things that I had not thought about during Operation Metro Surge is like the people who needed urgent medical care that were too afraid to go in to get it, and how you all showed up. I can just think about a woman who had a baby during Metro Surge and had not had any prenatal care after she had the baby. But the mobile medical unit was parked up on Penn, and she was able to go in there and get care and be directed to the right person. That meant everything to our community. I mean, it really is just such a safe place for people who are afraid. It's where they are. The fact that you were just moving around as needed and helping out the faith organizations and the people who were talking to people every day, that is something to be so proud of. I mean, you all really stepped it up. Especially, I can only speak for the north side because that's what I was paying attention to, because the requests were never ending for medical services, and that was from day one. And so I really do appreciate the work that you all did on a daily basis to make sure that folks were able to get at least basic medical care, at least some advice on where to go, who was a safe place to, what was a safe place to go to. That is, you did a great job with that, and I appreciate the mobile medical unit for that. I certainly also appreciate the vending machines in the fire stations. I think I got some numbers recently that Station 14 in Ward 4 is the most used station, and so I mean, you all have been there, you know what happens in the surrounding areas, and to have that resource there is also appreciated. It's always interesting when I hear people talking about Narcan and they say, oh, you can just go to the vending machine at the fire station. They talk about it like candy, right? Like it's just like a part of the community now. And I appreciate that, because that's the work you all have done. You don't just put it there and leave it. You put it there and you teach community how to use it, how to activate the space, that they're welcome there to get it, that there's no stigma associated with you going to help someone or you telling someone how to access it. And I think you've done a fantastic job at that. It is truly a community resource. And if I know you said there's going to be one more, Louisa, I urge anyone who has an opportunity to get one in their community to do so, because I know the one in Ward 4 is used greatly in North Minneapolis, not just by folks in need at that moment, but people get it for their family members. People get it because they encounter things on their way to and from home and school and work throughout the day that they want to prepare for, and that's good. That's good for our community. You know, we want to help our neighbors, and this is a tool in helping our neighbors. So thank you so much for that. Just overall, this is just really good work, and I'm so grateful that you all are presenting this and continuing to move forward. This youth development is also really good. And you know, I can't remember what name you use, but I call them CHWs. But like, using the folks who are in these communities every day to do this work is certainly the pathway to getting it done. They know better than we will ever know. As someone who comes from that world, like, you're on track for getting our young people trained and developed to doing this, and then using the people who are not only impacted but have the community connections to this. So thank you so much.
Thank you. And I want to add that the community navigators, or the cohorts, they've helped, folks are helping in developing the training and what, it's so that it's appropriate for each community. In terms of the mobile medical unit, I'd like also to add that we are not a primary care clinic, so we will not ever be someone's medical home, but we are committed to being in the same places on a regular basis so that people can approach us. And then we are working with our federally qualified health centers and other community clinics to ensure that that person gets connected to a medical home, because that's where ongoing care is going to happen. So that's part of the model. Thank you.
Thank you. I don't see anyone else on queue, but I did want to thank the health department and you, Louisa, for bringing us this presentation. It's really great work that is happening. It's good to see that at least it shows that the Narcan machine stations, number 5, that folks in the community know these exist, and that's a really good thing, because that means that we're able to save people's lives. So just thank you for the presentation, and I'm always super grateful for the Narcan machine. So thanks.
Thank you.
All right, colleagues. Seeing no further discussion, I'll ask the clerk to file that report. And seeing no further business before us, I will declare this meeting adjourned.
Which we all like clarity.